My name is Kim Murtha, and I'm a licensed professional counselor of mental health in the state of Delaware. I've also been licensed in Maryland, and I treat adults, children, adolescents, couples, people with substance abuse disorders. And one of the things that I've noticed with the upcoming change of season and school letting out is people become inconsistent with their mental health care. And I've found that although it feels like everything is good and you're out and you're having fun and it's summer, sometimes that can really hit an individual come fall, and they find that all that lack of structure in terms of seeing a counselor, of staying goal-oriented for things like depression, anxiety, adjustment disorders, they get off track and have some regressions. I think too in the summertime, there's this expectation that it's going to be fun and you're going to go see people, and individuals tend to either neglect some of their self-care, or individuals miss a person's cues for a need for mental health help. They may not see it.
So why do you think there's such a big drop off between the difference of consistency in going and getting help during the summertime? What are some of those things that people can look out for? Just mentally be aware of that result in maybe, oh, I'm fine, I don't need to go get care, or maybe not paying attention to as much as the fall and winter? Where's the separation there?
Yeah, so really good question. Part of this, I believe, is because people are going on vacation, they're visiting with family, they're doing things because their schedule's freed up a little bit to do those kinds of activities that you can't do when you have commitments to school and ball teams and things like that. So in the summertime, one thing to look for is, are people isolating? Are they saying, I just don't want to do this, I don't feel like it? For kids, if they're getting maybe whiny, or they're a bit more sullen, or if they're acting out aggressions, different types of anger. I think another reason is, in our culture, we look at summertime as a time to just take a break. We don't want to do anything. We look forward to summer. We kind of go all school year, and then we look at the summer as like, oh, now we can just lay back. And I think that's good in a lot of areas, but for mental health, the real key to treatment is consistency and meeting goals and keeping up with that and making sure that pathway is always there. You asked another part of the question, like how to help with that. And I think some of the things that can happen are, if it can't be that you meet weekly or bi-weekly that you're already set up in, maybe looking at meeting once a month during the summer and just kind of doing a check-in, because that can even keep people on track and remind them, like, this is what your goals are, this is what we're doing, here's what your coping skills are, this is the ground that you've covered already, or if something new comes up in the summer, which does happen. Another thing is we now have telehealth in a lot of forms, and it's so accessible. I know our agency and a lot of the work that you've done has made it very readily available. It's extremely user-friendly. There are some limitations with that. You do have to be in a state where the client is licensed. So for instance, when I was licensed in both Delaware and Maryland, if one of my clients went to Maryland and they were in Maryland, I could still treat them with telehealth. If somebody's down in Florida, I don't have a Florida license, so I can't really do telehealth. But if they're in the state and they're somewhere other than home, if they're down at the beach or they're visiting family or friends up north, then certainly we can do telehealth. Or if one of our clinicians here at the clinic is licensed in a different state and that person is in that state, we can treat.
I think it's related back over to something, because obviously I'm not a therapist.
Yeah.
But I think it sounds a lot like working out. That it's more so maintenance than it is anything else. If you would like to see results, it's not like the expectation to relate it over to something that I think everybody is familiar with as well, is that I'm not going to go into the gym once and pick up a weight and be huge or be in shape. And doing so, too, I'm going to see regression and fall off if I don't consistently go. And I think there is a big disconnect with people with the expectation of It's warm outside. I'm getting more sunlight. I'm getting more vitamin D. I'm fine. I'm good. I don't need anything. Like, I'm better now.
Yeah.
And I think it's a great point that it is more so maintenance, that even if I'm feeling okay right now, just staying on top of it and staying consistent is going to lead to a lot stronger of a foundation for success, is at least what I'm picking up on from.
Yeah, and I love the analogy. It really applies. One of the things I think of when you mention that are, especially in kids that have ODD, and these are where kids act out and they're very disrespectful and they need a lot of structure and a lot of consistency. And so sometimes things will get missed intentionally to say, okay, we're supposed to be here having a good time. I'm going to ignore that. I'm going to ignore this. Don't say anything about that. Let's not get him or her, started or get them to where they're going to be oppositional with us, ODD, oppositional defiant disorder, and try to make things nice or smooth things over. And when it comes time to start back with typical therapy again in the fall, we find that we have to really go back and do system work, the family system work, and get the system kind of going together again, and then work on the individual a little bit more too. That's a place where I see much needed summertime help. And schools have been really helpful with that. A lot of schools have added some summer programs. I know we've been doing a lot of work with schools in the area and trying to expand those services in the schools to students who would benefit from that.
Yeah, I think that leads over to my next question is like, that is a big hurdle. I mean, when maybe the initial family support system, or maybe the first degree of separation of support, the immediately close, isn't really established. So how do we solve that problem? How do you go through? Is there anything out there that assists with helping push people in the right direction? Does mental health need to try to fill that gap? What are some possible solutions out there to that problem?
So just so I can clarify, are you saying if the primary caregivers are not as involved with mental health and the school is the support system for that individual to have access to treatment? Yes, and so that's been a very big issue, and something that I hope that we'll even do more of here, maybe through our nonprofit outreach, is to develop maybe some summer programs, some 2 or 3 week programs where kids can come in and have maybe some kind of group thing, or they're able to come in and see a therapist while school is out, a therapist that they're familiar with. We have several clinicians here who go into the schools and work with individuals, the students one-on-one. And so when that alliance is already there, it's really nice to just keep that continued through those summer months. I think, too, that schools are open much more in the summer than they used to be. It used to be once June hit, they were closed down, and now we're seeing, like, between summer school and extended sports seasons and all kinds of things, the school is really a community place in the summer as well. And this might be an area where we can start also extending our time in the schools and saying, let's make ourselves available for these students who, like you said, they're going to fall through the cracks if we don't meet the needs. And those are some things that we could do to kind of fulfill that for that really at-risk population.
Yeah.
And it's an important time to make that happen. We don't want to wait until somebody is an adult to start working on depression or anxiety or ADHD or, aggressions. We want to start doing that early on. We want to do early interventions. So it is important that we're very visible and available in the school setting.
Yeah. So it seems like it's really like a 2-phase issue. Is one, educating, because obviously we're talking about the most high at risk. When you get to a certain age, you begin to police yourself a little bit more. I see that I'm struggling a little bit. I know that I haven't been going as much as when in the summertime. I'm hanging out with my friends. I need to stay on top of this. I should probably get back in. That's not really the population we're talking about. We're talking about the young adolescent group that maybe needs needs to be taken to go get that help that they need.
Yes.
And so it seems like a two-phase problem in which, one, it's educating whoever the primary caregiver is on being like, okay, I understand that summer is crazy. We got like 1,000 different things that we want to do. We got summer sports, we got vacations, we got all this stuff. Making sure that consistency, educating that consistency is going to really help in that child's development. But then when that primary care isn't there, that those kids don't sift through the crack, that we need to try to be involved in some sort of that way. And maybe assistance from schools, maybe assistance from other after school programs. I know Boys and Girls Club do an awful lot too during those summer months. Maybe getting involved in programs like that, and trying to bridge that gap so you kind of get everybody the help that they really need in that sense.
Yeah, and I think, what you're talking about is like partnering, our agency partnering with some of these other groups that already are accessible to children, and it really creates an open door for us to meet those needs that they have. Because some children don't have a system where they have supports for basic needs like mental health or even physical needs sometimes. So these community outreaches are a great place for us to partner with and create these extensions for services that are needful.
Yeah, and I think too, even transitioning over to, I know our work with the school a lot has benefited some of those children that need that type of education, but what we're also finding is that some of the educators are busy, and because that they're busy, I think it's changing the narrative of putting the self-help and the mental health on the back burner type of deal. Where it's just like, I got a lot going on right now, I'll get to it when I get to it. And then that causes more unwanted stress in the workplace, and now you're feeling more overwhelmed, and you're like, well, and it's just kind of seems like it's a vicious cycle of like, oh, I'm really overwhelmed right now, I'll get to it later, which then makes you more overwhelmed, which then you're like, oh, I got a lot more going on. So I think relating that back to that as well, and how can people who have these full schedules, even during sometimes the educators drop off during the summertime because their schedule opens up and then they can go get help. But even the consistency of care through busy seasons or high work seasons outside of the summertime, how can those people reframe that in their head to go get the help that they need? Or maybe it is changing that narrative, and what needs to happen so that we can change the narrative that those people can go get the help that they need.
I like that.
Seasons.
And I think sometimes when parenting is lacking, it's because there's also a mental health issue there, and that's another area where we can make ourselves available. A lot of times parents might lack parenting skills because no one mentored it for them or explained to them what mental health issues are, or have them identify, well, my child's not just acting up. My child might have ADHD, or my child might have some kind of developmental delay. My child might be struggling with depression. My child may be awkward in social settings, and that's why they can't create good friendships. And that piece, reaching out to that demographic, is also important, because once they get better or have more understanding, then they can help their child, and it just creates a stronger family system. Yeah, so maybe also really again partnering again and helping parents become not just educated but aware for their own needs, and then being able to help their children once their needs are being met. Because it is overwhelming. It's overwhelming to be a parent and not have the tools to say, how am I going to cope with all of this? How am I going to help my child cope? I don't even know how to help myself cope. And I think when parents realize, yes, I'm struggling with depression, or I'm struggling with anxiety, or maybe I have bipolar, and once I have like a good medicine regimen, then I'm in a better, more stable place, and I'm more able to handle. And that's another thing, with the summertime, for a person who has a mood disorder, you might be feeling all euphoric in the summer, and without some good treatment to say, well, it's not the summer that's necessarily making you feel all this way. This could be part of your mood disorder, and we need to monitor for that, so that when the fall comes, you don't have like this huge
slump.
Yeah, absolutely.
And I mean, how can people determine on whether or not, from a therapist perspective, that, okay, I'm having fun during the summer, and that separation of like, am I over the moon because like that separation between bipolar disorder and like, okay, am I having ups and downs because of the fact that I'm just having ups and downs and this is life, or I'm going through stuff, or the separation of like, I'm having dramatic ups and downs. How can a person determine the split between those two so that they can go get the help that they need?
Yeah, really good question. So one of the things is we make diagnoses based on symptoms. And the best way to do that is to be seen, have an evaluation, and see if your symptoms match up with bipolar. So some of the things that we see, definitely that you said, mood swings that have very dramatic shifts. So feeling, very euphoric for a long time, little need for sleep, very goal-oriented, maybe very chatty, and then all of a sudden you start phasing into a deep depression. You don't want to do very much, very isolating, hopelessness. Those are signs that you need to see someone and you need to get an evaluation and find out, am I truly suffering with bipolar? One of the things about bipolar is there's this organic aspect to it. It's not about external events that trigger it. It happens within because there's some brain chemistry involved. So once you get a diagnosis and you can be seen by a med provider, medications are really effective in managing that and keeping that more stable. So summertime's a good time to get that done because maybe there's a little bit of extra availability here at the clinic, and you can make some appointments and get in and get that seen to, so that you're not going on this roller coaster and taking everybody in your environment on the roller coaster with you. Because that's the thing. You don't struggle with these disorders in a vacuum. Other people are also affected.
Yeah. And it seems like it's almost like two different seasons, like for children and adults. Seems like during the summertime, schedules seem to open up a little bit more for adults and going and being able to go get help and everything. But then for the children and whatnot, now they don't have the support system that they get through school to be able to go get that help. And then vice versa, when the wintertime comes around, the children now have that support system, but the parents and the parental system and the adults now are all in full swing work mode.
Yeah.
So now that's where all the work needs to get done. So it seems like there's almost like two different seasons for both age groups, and especially when you're a parent, now you got to juggle both. And it's like, yeah, so now my child doesn't have the support that it needs, or the support system that was there previous, and I have to be that support system. Yeah. But then when the wintertime rolls around, now I'm in full swing, and I need to go. I can't manage going in and seeing all that kind of stuff. So I could definitely see how that, from an individual perspective and also a therapist perspective, that it would be very challenging to get those people in.
Well, I think the positive side of that is during the summer, when people have some of that downtime and kids don't have the expectation of school, they don't have that commitment, there can be an upside to that, which is now you can come in during the day. If a parent can come like during a lunch hour, if they're working, or if they're not working, anytime during the day, the child can come in, or the parent can come in. Something that I've done a lot of times is when I'm doing an intake for a child, I like to also speak with the parent, and this happened recently. And as I was doing the interview with the parent about the child, I recognized that the parent had some needs and was able to recommend them to another therapist here to do some individual counseling with them as well. And that parent's been working through a lot of their own needs. And so what we've done is we schedule the parents' counseling session at the time when I have the child, so the parent can come in during the summer.
That's great.
They don't have to pull the child out of school. They can both be here at the same time, and it makes it very convenient that they can both be treated and get some help, and it doesn't add any extra stress. It makes it very simplified. Yeah.
So circling back to the consistency of care, what would you say the differences between the two individuals, of one that, from a professional standpoint, from one that goes to and gets consistent care throughout the span of the year, and one person that gets it when they feel like they need it. So like, I might come in once and then 3 months go by and then I'll come in again and then maybe 6 months go by and I'll come in again.
So I have my own little terminology for the second one that you described. Like, people are experiencing some type of crisis and they just can't manage anymore, and they come in and things get better and they're like, okay, I'm starting to feel good. We're dealing with the thing that brought you here, that crisis, but we're not getting to all the underlying things that lead you into crisis, the things that trigger, the things that may be there from childhood, unresolved trauma, losses, grief. And those are the things that you can't be in a crisis in for us to start really delving into and treating.
Yeah.
So they feel a little bit of relief, leave, then another crisis comes up and they're back in 3-4 months later. I call that the crisis to crisis client.
Gotcha.
And I've been fortunate enough to kind of confront clients sometimes and say, you're coming in crisis to crisis, but we're not getting to the root issue of what's really happening for you, all the things that underlie that we need to delve into. So we've got to see each other in between the crisis, because dealing with the crisis, we can do that, but it doesn't really have any long-term lasting effect. It's just in the moment care. It just takes care of that incident. It's not getting to all the other factors that contributed to it.
Yeah, so it seems like it's like they're coming in for the Band-Aid fix for the problem, but the wound is still there.
The wound is still there and deep and troublesome. So I always like to encourage clients, like, even if you can't do it on a weekly or bi-weekly, even if we just come in once a month and keep things going consistent and make some broader goals until we can get to some of the more micro goals, that's even helpful.
Yeah, and it seems, that's part of our mission too with Mental Edges. I know that we're trying to get to the point where people can go, as part of our like marketing goal or marketing initiative, like our business goal, our mission statement is that we're trying to get people to get to a point where they can be independent again. And so that way there isn't that, there's a crisis, I don't know how to handle this, I got to go back. There's another crisis, I don't know how to handle this, I need to go back. But giving people the tools to be able to, that long conversation, to work through some of those problems. So that way they have the tools when a moment comes up again, they know how to work themselves through it. So that way they can get back again to being the individual that they were previous to coming in. So that way they can get their independence
They'll have
back.
those autonomous skills. They'll have some autonomy to take care of themselves and use what they've learned here. Because when people come in and they're consistent, that's what happens. They start learning, like, to recognize when they're coming into either a depression or anxiety, or if their moods are shifting, like, okay, maybe I need to go in for a med check and have things reevaluated. So they start assessing themselves really well. They understand the triggers, they understand the things that happen prior to going into a really, kind of slump, as we were talking about before. So it makes them a bit more mindful. It allows them to be more proactive about their care. And then also, too, people relapse. So they come in and they get better and they meet their goals, and we say, okay, good. We can discharge you where you need to be. And that's always the goal. And they might have a relapse. Something can happen that was catastrophic, or they might just have been, going through a lot of things and it accumulates and they need to come back in. That's always a good thing too. But when people have the skills to be introspective, they can kind of look in and say, I'm not doing well. I need to see somebody again. I need to just, kind of figure out what I need to do from here to see, do I need meds? Do I just need to do therapy again once a week or once every other week?
And I think that's really the important part, or the crux of the consistency of care, is that that is what results in that autonomy again.
Right.
The consistency of care allows you to get to the point where you are autonomous again and have those really good skills.
Yeah.
And without that, you never really get to that point where I'm still figuring stuff out. I'm still trying to compartmentalize everything, and then you're in that crisis to crisis mode.
Yeah.
And it's related back to what we talked, the analogy of the gym. I mean, you don't get the body that you end up wanting, or that summer body, or whatever the goal is to lose weight, without that consistency. So that is the goal that's there. That's the result that you end up getting from the consistency.
Yeah.
And I think that if we could just communicate that part, we could get that part across to our audience, our clients, our people, or anybody who is considering mental health, I think that would just be a huge impact to people, that consistency is going to get you the results that you're looking for.
Right. So what the research shows on outcomes is that individuals who seek therapy have a certain percentage of success.
Mm-hmm.
Clients who do med management only have a certain amount. But when those two are in conjunction,
Mm-hmm.
the outcomes are actually better all the time across all tests measured.
Mm-hmm.
And the best way to reduce the intensity and the frequency of a mental health disorder is the consistency. So what we find, again, through outcomes research is that when a person is consistent in their care and in maintaining goals and, doing talk therapy, doing med therapy, doing the coping skills that they learn,
Mm-hmm.
whether it be mindfulness or some other method, cognitive behavior, whatever, EMDR, which we also, quite a few of us here are skilled at that,
Mm-hmm.
that the intensity and the frequency of the issue, whether it's anxiety, depression, the ADHD things, angry outbursts, those are all decreased because there's been, like you said, that constant care going on.
That's awesome.
Yeah.
All right. I mean, I feel like that's a good place to kind of
Yeah.
wrap everything up with
Yeah.
and circle back. So I think that should be it.